Hi there, I'm the neuromuscular mechanic, and today we're going to be talking about ultrasound guided superficial peroneal nerve blocks. So, what do I use these nerve blocks for? I don't do these often, but probably the main indication would be a referral from a surgeon who's wondering about the role of surgical neurolysis to address pain from a superficial peroneal neuropathy. So, what I can do is I can do a diagnostic nerve block to that superficial peroneal nerve. If it takes away some of the pain or all of the pain, then the surgeon may sort of proceed with their intervention. And then other reasons would include sort of anesthesia for foot and ankle surgery. Like my prior videos, we're going to go through a checklist today before we look at the videos of myself. So where do you start with patient positioning? What transducer should you use? How do you start with the surface localization? What structures you need to identify on your pre-scan? And how do you get after your target? So with patient positioning, I'll have patients on their back, I'll have their knee extended, and I may have their leg mildly internally rotated. What that does is that allows me to access that space in between the anterior and lateral compartments of the calf. And that space is important because that's where the superficial peroneal nerve is and where we're going to target it. So we do that internal rotation. The transducer, because we're looking at superficial structures, I want the best resolution, so I'm using a high frequency linear ultrasound probe. With my surface localization, I take my probe and I put it in short axis. So one technique is to start distal third of the calf and just place that ultrasound probe where you feel the anterior and lateral compartments of the calf meet. That's where your nerve is going to be. Alternatively, what you could do is take your probe short axis, distal 1/3 of the calf at the anterior lateral border of the tibia, and then translate laterally until you appreciate those two compartments and the space between them. So we're going to show that last technique. With the pre-scan, we need to identify, again, as I've alluded to, muscles of the anterior compartment. We need to know where the anterior compartment is. The muscles that we find there include the TA or tibialis anterior, the EHL or extensor hallucis longus, and the EDL or extensor digitorum longus. Then the lateral compartment muscles would include the peronei. Often the level that we're looking at, it's the peroneus brevis rather than the longus, which may start to become tendon at that level. And then the fibula, which is deep. And once we've identified our target, we're going to go after it again in short axis, in plane from lateral to medial, and we're bringing the needle toward the nerve, which lies in that fascial plane in between the anterior and lateral compartments of the calf. And that's why it's really important to know where those two compartments are. So we're going to start here shortly with the ultrasound videos. So here we go. So I'm going to pause. So I'm about distal 1/3 of the calf, and I've got the ultrasound probe in short axis such that the one part of the probe is over that anterior lateral aspect of the tibia, which we see here on the image as that hyperechoic bone with the posterior shadowing. And then just to identify some muscles, here we have the tibialis anterior. You notice it's quite small, so because we're so distal, we don't really have as much muscle. It's sort of tapering to the tendon. So what I'm going to do shortly is I'm going to translate from this level, again, the distal 1/3 of the calf, I'm going to translate laterally away from the tibia while also doing some toe movements to show you sort of the different muscles of the anterior compartment of the calf. So what I'm doing is I'm flexing my big toe here. And so as I flex my big toe, you can see movement of a muscle that would be outlined as the EHL or the extensor hallucis longus, and then sort of lateral to it, which isn't moving as much when I bend my big toe, would be the extensor digitorum longus or EDL. So again, we've sort of now looked at sort of those three muscles in that anterior compartment, the tibialis anterior, the extensor hallucis longus, and the extensor digitorum longus. What I'm going to do next is I'm going to take that ultrasound probe, and now I'm going to translate even more laterally. And then what I'm doing is I just was doing some eversion, inversion, and you can see movement now of a different set of muscles that correspond to the peronei. So in this case, because we're more distal now, the peroneus brevis. So if you keep that in mind, you can sort of look at this image and say, well, to the left of the screen is my anterior compartment with the EDL, and then to the right is the peroneus brevis. So that's very important to keep in mind when we want to find the nerve. So I'm just going to sort of move the probe a little bit here to sort of optimize things. And so if I put this pectoral scheme up, this is what we're looking at. The EDL on the left, the peroneus brevis on the right, and then the nerve in yellow. And so that is where our nerve is. So again, if I identify the nerve, that is where my superficial peroneal nerve is. That prior image, it was in yellow. And so it's in between the fascial plane, between the extensor digitorum longus on the left and the peroneus brevis on the right. And that is where I'm going to do my nerve block. So I could bring my needle in line with sort of this red arrow here, in plane, short axis from lateral to medial, sort of bathing around that nerve in that fascial plane. And so that is how you could do the injection. And so you can appreciate how important it is with this injection to distinguish where the anterior compartment is and where the lateral compartment is, because that'll help you find the nerve. And so just going to sort of move things a little bit more here, and we're just going to end there. So I'm the neuromuscular mechanic, and I hope you found today's video handy. Take care.